For solutions and ideas that have been generated, please go to memoly.org. Social Security and Medicare was addressed, so is healthcare, and I believe that when you see those ideas, you'll support it. Do we have a problem? Yes. In the last decade, our U.S. military's healthcare costs have increased 50%. When I was with a general sales manager at Ford Motor Company, he turned to me and said, Mark, we could budget anything, but we can't budget healthcare increases, and nobody on this panel can, because they've been skyrocketing and costs have been placed on fewer and fewer people that actually have insurance. I am not for any legislation that creates a long-term subsidy for people on Medicare, because it places debt on younger folks. And debt is what drives people into poverty, and we've seen poverty increase as a result. Third is I would cash out people that would like to get a lump sum payment and waive any future obligation on the part of the U.S. government. I think we could work out a workable formula with an average interest rate of 4% return, and there's a lot of details that I could go into, but a 2-minute response, I can't do it, but I can do it after this show, and please come up to me and I'll explain more. And I really believe that we have to undo Obamacare. The reason being is, why should any American ever be penalized because of legislation? What we should do is have a standard deduction for health care on W-2 forms. So instead of having to justify that your medical expenses exceeded 7%, we should just have a standard deduction for every person for the cost to have insurance for their family. That would remedy the situation. Everybody that files taxes would get a deduction for paying for health care, and we could bring it to more citizens. And tort reform is a no-brainer. We have to have it because of these lawsuits that are unjustified, driving up costs. And the bottom line is, let's attract more doctors into the profession. When people say they'll abandon the Department of Education, we could do a number of different things to bring science to schools so that people are curious and pursue the field of medicine. And with more doctors in the system, we'll be able to help people and reduce medical costs.